Step into office hours with California's doctor, where health meets real talk. Hosted by the California Surgeon General, these conversations will tackle health issues that truly impact everyday life. From mental health struggles to game-changing medical innovations in public health, we will dive deep into the topics that matter most to Californians and their community. Informative, empowering, and thought-provoking. Whether a professional advocate or simply curious about improving well-being, these conversations are a trusted source for insight and guidance. Your health is the foundation for a healthier future. Let's build it together. On this episode of Office Hours with the California Surgeon General, Dr. Diana E. Ramos sits down with Dr. David K. Stevenson to discuss preventing preterm birth and preeclampsia.
Hello, it gives me great pleasure to be here with you on our next session with our key leaders in California. And today, Dr. David Stevenson from Stanford University is with us. Dr. Stevenson is going to be talking with me about solving the puzzle of preterm birth. He has held numerous leadership roles at Stanford University School of Medicine, including Vice Dean, Senior Associate Dean for Academic Affairs, Senior Associate Dean for Maternal and Child Health, Co-Director of the Stanford Maternal Child Health Research Institute, and Director of the Prematurity Research Center at Stanford, and so much more. On a personal note, Dr. Stevenson has truly been an ally and a mentor for me personally throughout my entire career as a public health leader, OBGYN, and really an advocate in helping improve the health of moms and babies throughout California. Dr. Stevenson, it is truly my pleasure to have you here with me today. Thank you for taking the time out and for helping us understand a little bit more about how we can solve and what we are doing in California to solve the puzzle of preterm birth. You have been one of the forefront leaders. So let's start. Can you tell us a little bit about your journey and what inspired you to focus on preterm birth?
First, Dr. Ramos, thank you so much for that kind introduction. I've spent my whole career, now over 45 years, taking care of preterm and critically ill babies, dealing with all their complications, which are often life-threatening, and for survivors can cause lifelong problems. And preterm birth is the leading cause of death under 5 years of age worldwide. Providing such care is extremely costly, but the burden on families and society is not only financial, it's very personal for families and their affected children. A little over a decade ago, I was asked by the March of Dimes to lead a transdisciplinary effort to better understand the causes of preterm birth, including preeclampsia, which is a hypertensive disorder of pregnancy which can kill or injure the mother and the baby, and to discover better ways to prevent these conditions which cause so much harm to women and their babies. So that's how I got started. And since that time, I think we've made incredible progress and have worked closely with the state of California, now with you directly, to address this really important problem for the public.
Yeah, so I can tell you personally, as an OBGYN, caring for a mom who delivered a preterm baby, it oftentimes very heartbreaking because of the fact that now a mom, the stress of the mom in caring for a preterm birth, oftentimes not knowing the outcomes, and knowing what we could do to help prevent. Early on, there was not much information available, but you have been part of the research that has provided us insight on opportunities to actually help prevent preterm birth. So thank you for that leadership. Now, oftentimes there are misconceptions about preterm birth and what preterm birth is. Can you share a little bit about some of those misconceptions and what you share with patients?
Sure. Obviously, giving birth to a preterm baby is scary. Scary for the parents and sometimes for the doctors as well. I think that one of the most common misperceptions is that preterm birth affects only poor mothers or Black mothers, but it can happen to any pregnant woman, and the cause is most often unknown. Any birth uh, earlier than 37 weeks gestation, and most women have a due date that's projected around 40 weeks gestation. But any birth before 37 weeks gestation is categorized as being preterm. But the scariest ones are for the babies born much less gestational age than that. Sometimes as early as 24, 25, 26, 27, 28 weeks gestation. These very immature babies are not only immature, but very, very small. There are no good ways to predict preterm birth or really prevent it from occurring at this point in time. However, the other important thing to remember is that Black women are at much higher risk for preterm birth and preeclampsia, even though it's possible that any mother could experience this. The reasons are not simply explained by the usual social determinants, such as poverty. And I think that structural racism is likely a factor in causing preterm birth.
Yes, it is a complex issue, of which sadly, when you look at the advancements that we've made in healthcare, preterm birth is one of those that we've had a harder time making bigger inroads. But you mentioned that there are disparities and the importance of really taking into consideration not only the social determinants of health, but the fact that racism for many people plays a big role in the outcomes of not only their health, but the health of their pregnancy and preterm births and of their babies. Are there any solutions, any insight on how we can solve the puzzle of preterm birth impacting individuals and communities in the long term?
Yeah, you're making a really important point about the fact that this has been an intractable problem. That's exactly why the March of Dimes reached out to us at Stanford to see if we could help solve this problem. We need to understand how social determinants and how structural racism get under the skin and into the biology of a woman, uh, predisposing them to early labor or the hypertensive disorders of pregnancy like preeclampsia. This will require this kind of transdisciplinary team of scientists that we've assembled here at Stanford. And we've done this at other places across the state of California, and there are other places in the country that are attempting to do the same thing now. But these teams of scientists, public health experts, and partnerships with communities that have families at risk for these conditions is an important way to move forward in solving this problem. And I think we have made progress over the last decade with the help of enlightened leaders in the state, including yourself, that are allowing us to move forward and provide people with the tools that they're going to need in their communities to help us help them solve these problems.
That's right. I think you touched on a really important component, is involving the community in the solutions, because oftentimes we forget that when we're in a research institute or university, what is available, what is doable in the community is quite different. And that's why I appreciate your approach, Dr. Stevenson, that you really take the whole approach into consideration, the whole community, the life course perspective, because it really is where the people are living, how they're living, that plays a role in their health. And Stanford is, and through your leadership, is really taking that into consideration. Now, I also know that Stanford is one of the leading areas where technology innovation is happening. So would love to learn if there is any role of technology as well as policy and community action that is in play when we're talking about preterm birth and solving that puzzle in preventing preterm birth.
Yeah, I think, again, to emphasize partnership, yes, Stanford University, like other universities, has a lot of really smart people with a lot of different kinds of expertise, and they have a societal obligation to try and make a difference that will help people in many different ways, whether it's related to healthcare or climate change or any of the other problems that are relevant to public well-being. So I think partnership is the right word to be using here, along with the fact that we want to be able to take advantage of the newer technologies and advances that can occur at universities like Stanford. But we don't see ourselves as isolated. We partner with other great institutions throughout the state of California. We're blessed in the state with having many. And for us, we have one right nearby, UCSF, which is also an extraordinary institution. We've already made important advances in our understanding of the conditions such as preterm birth and the hypertensive disorders of pregnancy, and are developing tests that can identify women at risk as early as 10 to 12 weeks gestation before there are any clinical signs of these conditions, and early enough to be able to intervene and prevent, or at least ameliorate or lessen the severity of these conditions, saving mothers' lives, preventing injuries, and saving babies' lives and injuries. And we're working with the state directly with you to ensure that women can identify themselves as at risk and then be directed to healthcare facilities that can treat them appropriately, while we also ensure that the facilities themselves and the people that are in those facilities are knowledgeable and have the resources they need to do what they need to do to help these women. So it's a partnership with the communities, but it's a partnership with the state and its resources and with the institutions across our state to make these advances. And of course, we'll share these advances with institutions across the United States and around the world. But if you can actually identify someone who's at risk before they show any signs of early labor or any signs of preeclampsia at around 10 to 12 weeks gestation and intervene, that's a huge step forward to improving public health and avoiding a lot of preventable problems and complications that could complicate the lives of people. I think this is a really important approach.
Yeah, I think you're right on. And you mentioned the fact that, being in the community, pulling in the knowledge of how do we know when somebody is at risk for preterm birth. And oftentimes we miss the opportunity to take advantage of addressing some of the predisposing health conditions that can contribute to preterm birth. And that's before a person becomes pregnant or preconception. And thank you so much. You were very helpful and insightful in our development of the preconception medical assessment that was led there at Stanford. Stanford researchers, Dr. Sisapadia was our principal investigator there at Stanford to help us validate and come up with a resource that people can take an 8-question assessment, an 8-question quiz, and just start to think about their health before they become pregnant. And oftentimes addressing chronic medical conditions such as high blood pressure, such as diabetes, all of these things build up and can help address the prevention of preterm birth. So thank you so much for your partnership on that. And I know that, yes, the interventions for preterm birth are critically important when we are caring for a pregnant mom, but then also I always leaned on my neonatologist partners at the time of delivery to help support that baby. So grateful for everything that you and all of the neonatologists do to help support the outcomes of a healthy baby. Can you share a success story where there was a measurable difference in what you are doing and what you are leading? You've had a very illustrious career of direct patient care research and now really leadership in the field. I'm sure you have one or two stories that we can see all of your leadership in action.
Well, you never do anything by yourself. So I think it's important to understand that anything that we've accomplished has been a team effort, and it involves a lot of different people making observations that have helped us improve the healthcare for pregnant women and for their babies. And we have to also remember that we're taking care of families at the same time that we're doing this kind of work. I think one example that reflects a lot of work is the use of low-dose aspirin. We have a campaign going on now in the state of California to try and educate people about the benefit of low-dose aspirin for women who are at high risk for preeclampsia. And as an added benefit, it turns out that aspirin also reduces preterm birth. At Stanford, we're now beginning to learn how aspirin is working. It's not working in the usual way that people think about aspirin as, relieving a fever or pain. It's working in different inflammatory pathways that can actually prevent the onset of preterm labor and the occurrence of the inflammation that is contributing to preeclampsia, which is the hypertensive disorder that occurs in some women. We've learned that this common over-the-counter drug can affect important biologic pathways and that it can lead to a better pregnancy outcome. And there are now other drugs that we're investigating that may be repurposed for the same kinds of uses. Some of these may also be available over the counter. So I think this is an area where, because of our ability to understand how these drugs, which are currently perhaps indicated for other purposes, might be useful in preventing preterm birth and preeclampsia, and they might be available over the counter and at very low expense and prevent these very serious complications, which are not only disruptive to a woman's life and a subsequent baby's life and healthcare trajectory, but also extremely expensive. Expensive for the state as it provides, resources to help take care of the kids that are born and the women who are suffering from these conditions. But I think this is something that we have to do more of, is to look for ways to identify women in advance of these complications of pregnancy, avoid these adverse outcomes, and look for well understood and better ways to prevent preterm birth. So I think that's the approach that I would suggest, and where we've had already some wins, and I think we're going to have more, and probably make a difference in the state of California that'll be an example for the rest of the country and probably the world in terms of our ability to actually reduce these occurrences.
I love it. Thank you so much for that simplistic, really, if we think about it, a baby aspirin, right? A baby aspirin, which costs pennies, if at all, to help prevent preterm birth, preeclampsia, and yes, to relieve pain if there is some pain, inflammation. So simple, and it's your research that you're helping lead that is making that happen. So thank you. Yeah, that is really important and very applicable to many people. Now, what are some practical tips our listeners can take away to improve their health in this area?
Well, I have one really practical tip, and this one will be close to home for you. I think people need to become familiar with the state's efforts to educate pregnant women about how to identify risks for preterm birth and preeclampsia and other adverse outcomes of pregnancy. And as you're suggesting, the state has recently developed PreMA, which is a tool that can be used, a very simple one that will help women identify themselves as individuals who might benefit from seeing their doctors early in pregnancy and complying with all the recommendations for ensuring the best pregnancy outcomes. So my main tip is that they should pay attention to what our state is doing and use the tools that the state can provide to help individual women identify for themselves if they need to seek out additional care earlier in pregnancy and do things that can help them have a better outcome.
I love it. Thank you so much for that tip. I highly, highly second and agree with your recommendation on promoting PreMA. So now I'm just going to ask you two questions that I ask everyone when I speak with them is, what does health and well-being mean to you personally?
Well, it's a good question. Of course, I like to be healthy like everybody else, but I think it means to me not just simply reacting situations where you have poor health or you have a problem. We have to continue to do that. But I think what it means to me most of all is preventing pathologic conditions, dangerous health dispositions, and harms before they occur, and not waiting for a condition to be diagnosed so that remedial or rescue treatments are needed. Medicine historically has been practiced by identifying sort of categories of disease when bad things have already happened to a person. Why not have a better understanding of how people get onto those adverse trajectories and then avoiding it altogether? That would not only avoid a lot of problems for people as individuals, but also decrease the cost of healthcare, um, not only in California, but elsewhere around the country. And so I think that prevention is much better than simply waiting for something to go wrong and then trying to recover somebody from that circumstance.
Highly agree with you, Dr. Stevenson. Yes, prevention really is the easiest way to go. And then my final question is, what's one innovative idea to improve health in California? You're doing so much, but what would be one?
Um, well, I think that I would end with something that you'll probably like as well, which is that I think that we need to partner more closely with our communities. Our communities are like subcultures, and they're all different. They have different leaders and different people who are influencers in those communities. We need to partner with communities, engaging their leaders to ensure that women are educated about how to access the healthcare resources available to them in those communities and help them address the factors in those communities that are unique in those communities that can ensure the best pregnancy outcomes. So I think that rather than, suggesting that Stanford University or UCSF or any of our great institutions and all the smart people who are there can solve the problems by themselves, simply because they understand, let's say, the causes of preterm birth, and have new ideas about how they might prevent it. The best way to actually solve this problem, practically speaking, is to partner with communities, ensure that they have the knowledge and expertise, and then the unique perspective to address the problems which are contributing to preterm birth in their respective communities. I think that's the secret that needs to be now understood by more people. You can't solve the problem by yourself just because you're smart or you're technologically advanced. You need to partner with the leaders in communities, and help them solve the problem. And you can't do it without them, basically. That's my perspective and my one innovative idea that I think can improve health in California.
And now I know why you are a true leader, because you can't do it alone. Yes, absolutely. And the community is key. 80% of health happens outside of the healthcare setting, and that's in the community. Dr. Stevenson, thank you so much for your time, your leadership, and your vision, because your vision and your partnership is truly innovative and has led to really changes, like you said, that are making a difference not only in California, but throughout the nation and the world. So thank you again so much for your time and for sharing how you are helping solve the puzzle of preterm birth.
Thank you, Dr. Ramos. It was a pleasure to speak with you, and keep up your good work. And let's make California a demonstration project for the entire country and the world.
Let's continue together in health.